morning, good afternoon, and good evening. Thank you for joining us for the first of the Global Health Advocacy Incubator Food Policy Program 2021 webinar series. Today, we're going to be discussing the latest evidence on SSB taxes. So we have a panel of experts who are going to talk about the efficacy of SSB taxes, and on decreasing SSB consumption and purchasing and improve health outcomes. As Olivia mentioned, following the presentations, we're going to have Q&A. So please enter your questions in the Q&A box. To start the session, we're going to first hear from Dr. Shuwen Ang, Associate Professor in the Department of Nutrition at the Gillings School of Global Public Health at University of North Carolina. She'll be giving us an overview of the implications of different types of SSB tax designs. Dr. Ang is a health economist whose research focuses on understanding individual and household level decisions about dietary behaviors and their health impacts. She uses a multidisciplinary approach drawing from economics, epidemiology, sociology, and public policy. Next, we'll be hearing from Dr. Arantxa Colchero, Associate Professor at the Center for Health Systems Research at the National Institute of Public Health in Mexico. She'll be talking about Mexico's SSB tax and its impacts on purchasing, employment, and oral health. Dr. Colchero's research analyzes the nutrition transition in low-income countries, studying how food environments have contributed to the obesity epidemic in rural and urban areas. She's been working on the design and impact evaluation of fiscal policies to reduce consumption of SSBs and energy-dense, nutrient-poor foods in Mexico. She's currently evaluating different scenarios of tax increases in Mexico for alcohol, SSB, and non-essential foods. Dr. Colchero has also collaborated on the impact evaluation of the marketing regulation and labeling in Chile. Then we're going to hear from Dr. Tona Barrientos Gutierrez, who's director for the Center for Population Health Research in Mexico. He will be highlighting studies that show the impact of SSB taxes on health outcomes and the cost effectiveness of these taxes. Dr. Gutierrez is a medical doctor at the Autonomous Metropolitan University in Mexico and a doctor in epidemiology at the University of Texas at Houston. He is also the director of the Center of Population Health Research at the National Institute of Public Health and a member of the National Academy of Medicine in Mexico. He works in several areas of public health, including tobacco control, obesity, diabetes and cardiovascular disease, and child development and teen pregnancy. Currently, Dr. Gutierrez is working on the identification of structural interventions to reduce addiction, chronic diseases, and teen pregnancy. Finally, we're going to hear from Professor Karen Hoffman from the South African Medical Research Council's WITS Center for Health Economics and Decision Science. She'll be discussing the latest evidence on South Africa's sugary sweetened beverage tax, also known as the Health Promotion Levy. Professor Hoffman is the founding director of the South African Medical Research Council Center for Health Economics and Decision Science at the University of Witwatersrand School of Public Health in Johannesburg. Professor Hoffman is a WITS medical graduate and a qualified pediatrician. She was previously faculty at Johns Hopkins University in the US and served as Director of Policy and Planning at the US National Institutes of Health Fogarty Center. Professor Hoffman leads a multidisciplinary policy research team to evaluate interventions that can provide the biggest return on investment. She was instrumental in passing the mandatory salt regulations and the sugary sweetened beverage tax in South Africa. Professor Hoffman is an elected member of the Academy of Science of South Africa, and in 2016, she received the Public Health Association of South Africa Annual Award that honors excellence and commitment to public health. And just last year, she was the first recipient of the University of Witwatersrand's Vice Chancellor's Social Impact Research Award for high quality research that influences best practice policy and has social impact. Now I'm going to turn it over to Dr. Eng to talk about the implications of different tax designs. Thank you.
Good morning and afternoon or evening, everybody. Thanks for this opportunity to share some of the research and also provide an overview of some of the sugar-sweetened beverage taxes that have already occurred globally. I'm going to start off by providing an overview of the tax designs to date and their implications. Next slide, please. I first want to start by drawing everyone's attention to two recent publications that came out from the Pan American Health Association. One talks about, which is on the right, talks about the various types of taxes that currently exist in Latin America and the Caribbean. And the other that I think came out probably only about a week or two ago, that builds on that further, and actually that includes a meta-analysis of the evidence to date in the Americas around sugar-sweetened beverage taxes. I highly recommend looking into these two resources, and I've provided the links below. I believe the presentations will be shared after this webinar. Next, please. So I want to start by going through several considerations when we're thinking about SSB tax designs. And I'll start with the types of taxes and then their structure, followed by the tax base and the levels. But of course, all of these interact with each other. And really, the decisions that are made around each of these steps, or they're not really steps, but each of these components should be based on, can you press the next animation, right, what the overarching goals are. So that's really important to keep in mind, and I'll discuss that as well as the implementation mechanisms that might be in place and available to put the tax design into action. Next slide. So I'm going to start with the tax type. Basically, what we're talking about are consumption taxes, various forms of consumption taxes. And one way to think about sort of the nomenclature and also how they relate to each other is to think about whether it's levied directly onto consumers or levied through the supply chain. For those that are levied through the consumers, a main one that's often that you're probably many of you are aware of are called general sales taxes, or GST. And these are typically, depending on the country, but in many places, typically only seen at the point of checkout or when people are paying, and therefore may not necessarily impact the public's decision when they're at the shelf and making decisions about what to put in their basket or their cart. Conversely, taxes that are levied through the supply chain are frequently seen on the shelf price. And then these types of taxes can also take multiple forms. Import tariffs, which are levied on distributors, is one type of this sort of tax. There are also value-added tax, VAT, and VATs can be structured either in terms of single stage or destination-based, and therefore only taxed at one point in time at the end, or multi-stage, which could create some challenges for the tax agency to collect, because it would have to go to many more entities to collect the tax. And then another type of tax that goes through the supply chain are excise taxes, which are levied on manufacturers and distributors. The evidence to date seems to suggest that probably excise taxes that are levied on manufacturing distributors from a feasibility standpoint in terms of tax collection is the most efficient. And then I'll talk about the tax structure next as well in terms of the pass-through. So let's go to the next slide. So on the tax structure, here are some ways to think about it. So you may have heard of the term ad valorem taxes. This basically means it's based on a share of what we call the base price. But then, of course, devils are in the details, and what is used or defined as the base price becomes important. So this is an issue that some care should be given towards. Ad valorem taxes, because it's percentage based, will account for inflation as prices change. So that's built into the structure of these percentage based taxes. However, evidence to date shows that the pass valorem taxes onto the prices that consumers see are generally less complete. So as a result, for let's say 20% tax, the consumers may not see an actual 20% increase in price. Also, because it's based on it's a percent base, it is more likely to make cheaper brands more appealing because their base price is lower and therefore their price increase will be smaller. Another type of tax are called specific class of taxes, are called specific taxes. These are based on a particular unit of measure, and often most common in many places are what we call volume-based taxes, such as in Mexico, which was a 1 peso per liter tax, and also many locations across the US, 1 penny or 1.5 cents per ounce taxes. Other units of measures could also be used, for example, based on the sugar density of the product of the drink. In addition, it is possible, and we've seen examples of this, of combining different units of measure. So here I've provided an example of a tiered version that combines both the liter and, which is a volume, and sugar density in the design for here. Like, so $1 tax per liter if a sugar density is below 5 grams, or $2 if the sugar density is 5 to 8 grams, for example. Similarly, you could design it based on some kind of floor and linear design, similar to what has been done in South Africa, for example, with a 0.21 rand per liter tax for each gram of sugar density above 4 grams per 100 ml. Because these are absolute values in terms of the amount of the tax, there will then be a need to adjust these tax levels based on to account for inflation if the level of tax wants to remain the same. Evidence to date shows that the pass-through of these taxes onto the prices that consumers see are generally more complete. So that's an advantage of the specific tax over the ad valorem tax, but of course that comes also at the issue of potential inflationary concerns if those adjustment for inflation does not occur. And then finally, it is actually also possible to consider hybrid tax structures as laid out here in these two examples. To date, this approach hasn't been used yet in any countries, but it is a possible approach to take. It does get a little bit more complex potentially from an implementation standpoint, but then this is also a function of what the overall purpose of the tax is meant to be, which I'll get to next. Next slide, please. Okay, so the next area is to discuss what the tax covers or exempts. Can you press the animation, please? Yeah. So I think it's pretty clear that sugar-sweetened beverages that must be covered as best possible include things like carbonated soft drinks, fruit drinks, energy drinks and sports drinks, and then ready-to-drink sweetened teas and coffees, for example. The second category of products that should be covered but may be difficult to do so initially include things like drinks with artificial sweeteners or non-sugar sweeteners, 100% fruit juices, sweetened dairy and substitute drinks, and concentrates. This include liquids and powders. And then finally, products that should be exempt from a tax, and these are the healthy beverages that we want to encourage instead, include drinks like water and plain milks. Next slide. And then finally, we also want to talk about the tax level. To date, the general advocacy has been focused on pushing for 20% taxes or equivalent. But I would also argue that this tax level really should be based on the context in question, the country or location in question. And really, some of the considerations include what is the baseline level of consumption by the various beverage types that might be covered by the tax? And what is the reduction for that particular context that is needed to see meaningful longer-term health outcome changes, which links to Tona's presentation, the third presentation, as as well, I think. And then based on the reductions needed, then what tax level might allow for this? And then, of course, the tax level is going to have implications for the potential revenue that's generated. It's pretty obvious that a higher tax level might lead to greater revenue, but it's not necessarily the case, because while you may have greater reduction, you're playing a balancing act between a greater reduction in a tax item, but also more revenue collected among the tax items. So it's unclear actually what the tax revenue implications might be depending on the tax design. And then, of course, depending on the tax design, if it's based on sugar, then there may be expectation of reformulation to avoid the tax. And that, again, will have implications for the tax revenue. And then finally, the expected pass-through is going to depend on the beverage market in question and the structure of that beverage market, and whether it's dominated by a few companies or it's a very competitive market, and therefore it's more likely that companies will actually pass through the tax onto consumers. Next slide. Okay, so I've talked about sort of those three interacting and intersecting decisions that need to be made. And under the overarching goals that should be identified within a pretty complex system. Animation, please. Yeah. So, I mean, we are probably, one of the major goals, right, would be to lower sugary drink consumption while also increasing healthy beverage alternatives like water. Next. But depending on the design, if it's focused on sugar density, for example, you may result in an increase in the use of artificial sweeteners or non-sugar sweeteners. And so then the decision needs to be made as to whether or not that is an outcome that is preferred given a particular context. And then, of course, there's the revenue generated from the tax. Is that going to go towards a general fund, or is it going to go towards health-related funds, such as supporting the installation of water fountains for children in schools or in public spaces, as well, or things like public health campaigns around sugar-sweetened beverage consumption, or encouraging healthier diets and health promotion in general? Next slide. And then finally, I wanted to touch on implementation mechanisms to keep in mind as well. So I've laid out three main mechanisms that I think many of us have been exploring and discussing. This includes using nutrient profile models, using tariff codes to determine what products are taxed or exempt, and applying the tax base through that, or defining what is included versus excluded within the regulation of the law around the tax. There are pros and cons to each of these options, and we can go into further discussion on that. But I'm mindful of time, so I'm not going to read each of these. We can come back to this at the Q&A. I just want to end by, next slide, please. I just want to end by reminding everybody about the need to think about the intersection and interaction of these key dimensions when considering tax designs. And we will go on from here in our discussion, I guess. So next, I'm going to pass the floor to Arantxa.
Thank you, Shu, and thank you, everyone. Thanks for the invitation. I'm going to go through the SSB tax in Mexico. Next, please. So I'm going to give you a little bit of the context that explain why there was an SSB tax implemented in Mexico. So overweight and obesity reached 70% of adults and 33% among children. We had a 14% prevalence of diabetes with very, very high cost. And Mexico was the second SSB consumer after Chile. And added sugars represented 12.5% of total energy intake, and among those, 70% are SSBs. Also, I'm not gonna talk about that, but the non-essential energy dense food represents 16% of total energy intake in Mexico. Next, please. So the tax in Mexico that was implemented in January 2014, it's an excise tax of 1 peso per liter. That represents around 10% increase in price. And it applies to all non-alcoholic beverages with added sugar. It excludes 100% juices. We have very few in the country, and beverages with artificial sweeteners. And one interesting thing about the tax is that it is higher for larger packet sizes, which are less expensive. There's a big gap price in Mexico, maybe in other countries also. And somehow, even if this is a small tax, it's a good tax because it tends to reduce the gap, between the price gap. The tax is paid by the producer, and it is, at the beginning, it was adjusted to inflation if the cumulative inflation reached 10%. So it took about 4 years for that. But since 2019, we have annual adjustments. Next. So just to give you this framework of how taxes work. So taxes can have an impact on consumption, basically through prices. If prices went up, then you would expect, of course, to see reductions in consumptions. It could be the case that people would perceive taxes as a signal and reduce their consumption, maybe not in the short terms, but maybe social norms start to change. That happened with tobacco. And maybe the way the government frames the policy, that could have an impact on consumption also. But basically what happens is through prices. Of course, if there are reductions in consumptions, there may be reductions in calories, although it's difficult to prove that, to evaluate. You would need to have very good data on that, and then have impacts on health. There's always the concern that if there's a reduction in consumption, that would have implications on employment. And this is something that countries, if data are available, should look at that. Of course, taxes raise revenues, good amounts of revenues. In Mexico, the problem is that you cannot earmark them. You don't know what happens with revenues. And there have been attempts to try to talk with the Ministry of Finance to see in this new administration if revenues can be earmarked, but this government doesn't like taxes. Of course, another concern is the differential income burden, and if it relies on the poor. Next, please. So I'm going to talk about the impact evaluation that we have been conducted. And first, this is a summary graph of what we found in terms of changes in prices. So you can see that in rural areas, the prices increase, but less than the amount of the tax. So it's below 100%. What this is expected given the price elasticities were larger in rural areas. But in urban areas, which is about 80% of the population lives in urban areas in Mexico, there was a complete price pass-through, very heterogeneous. And so the industry decided to have an overpass for the smaller packet sizes. Remember that with the excise tax, the bigger packet sizes pay more, but they did the opposites. And you can see that there was not a pass-through, an incomplete pass-through for the juices and flavored water, which are not very consumed. Really, the market in Mexico is about 85%, it's on soft drinks. But so on average, And in urban areas, there was a complete pass-through prices. So one would expect consumption to change. Next. So this is a summary of the results of the studies that have looked at changes in household purchases and sales. And as you can see in these different studies, in general, the first year, the reduction in taxed beverages were around 6.2, 3.1%, and there were larger reductions in the second year. So at the national level, using sales, there was an 8.5 reduction in taxed beverages, and in urban areas, a 9.2% reduction in taxed beverages. Of course, because there was an incomplete pass-through prices in rural areas, we see that there were reductions in purchases of taxed beverages, but this is lower compared to urban areas. So in rural areas, there was a 4% reduction in taxed beverages. In general, in all studies, we can see larger reductions among lower income households, among high consumers in urban households, and in households with children. There have been a couple of papers around that have seen even larger reductions in taxed beverages. And I have to say that there have been also increases in untaxed beverages, particularly bottled water. Next, please. So because there were a lot of concerns that there could be negative impacts on employment, what we did is we looked at changes in employment in the industry that manufactures beverages, in commercial stores, and unemployment rates overall. So we have, Mexico has data, and what we found is that this is very interesting. If you look at graph, the figure 1A, that there have been reductions in employment from a long time ago in the beverage industry. They've become more productive. So this is not because sales went down before, but they became more productive. And so you can see that after the taxes were implemented in Mexico, there were no negative impacts on employment. There wasn't even a very, very small increase. We didn't see any reductions in employment in commercial stores, and particularly there were concerned that in these small stores that sell beverages and food, there would be reductions in employment. We didn't see that. There were not reductions overall and by size stores. And of course, we didn't see any reductions in unemployment rates in the country. And so for this study, we use 2 years after the taxes were implemented and previous years previous to the tax implementation. Next, please. So, of course, there's always the concern that taxes could be regressive. And although we haven't conducted any formal study, the table shows you the percentage of SSB expenditures over total food and beverage expenditures. So you can see that in 2012, for the lower income quintile, that represented 2.8%, and for the higher income quintile, 1.3%. So there was a difference of 2. But in 2016, 2 years after the tax was implemented, you can see that there's not an increase in this share for the lower income households. So even there's a very small decrease. It's 2.7% and 1.4% for the higher income quintile. So it doesn't look like this was an income burden. And maybe this is because consumption among low income families was reduced more. And of course, and Donatu will talk about this, there are potential effects on health and healthcare expenditures associated with the taxes. And Of course, extended cost effectiveness analysis should be conducted to see any effects. Yeah, I'm almost done. Next slide, please. And so we also looked at changes in oral health, because this is relatively quick income where you can see reductions based on reductions in sugar consumption. So we look at outpatient visits, and we saw reduction in the post-hoc trends of outpatient visits. We also looked at dental caries, and we saw reductions in the probability of having experienced dental caries and number of teeth with caries experience, reductions in the population with dental caries, and reductions in the mean number of teeth with dental caries experience. And the next one. So just to conclude, hello?
Next slide, Jade.
Is it not showing?
No, it's my final slide. I'm just gonna, yeah, okay, thank you. So of course, SSB, when you have an excise tax, you need to make sure that you will have annual adjustment to inflation. We do have since 2019, and maybe think about adjusting to economic growth also. One thing that we're considering in Mexico is to increase the tax to get more benefits, and to look at optimal taxes to reduce the burden of the taxes in terms of employment impacts and income burden. Maybe the feasibility of adding an additional amount to the existing tax to beverage with higher sugar content, so you can incentivize reformulation. Of course, we would like to make taxes earmarking possible to correct for externality. Maybe, and something that is necessary in Mexico is to make water available in poor areas, and look at subsidies to healthy food, because we've been concentrated to reducing the consumption of unhealthy food, and now we should turn to subsidies to healthy food, maybe using the revenues from tax foods and beverages. So thank you, and please, Donna, you can go ahead.
Thank you, Arantxa, and good morning to everyone. I would like to talk now about the different ways in which we have been analyzing the potential impact of the sugar, sweetened beverages tax in Mexico. The next one, please. So I have three aims, and first I would like to show you how is it that we have been analyzing changes in consumption at the individual level. The second one is how are we using the studies that Arantxa and her team have been leading to estimate consumption changes into the expected changes in health outcomes. And I will talk about body weight, overweight, obesity, some of the cardiometabolic diseases, and how is it that we have been approaching this for adults and for children. And then I will finish by talking about cost effectiveness of the tax and how is it that we evaluated that. Next, thank you. So we have been using different approaches to model and evaluate the tax. First, I will start by showing you a cohort study. So this is an observational study in which we measure the consumption of SSBs before and after the tax. And using that information, we estimated the changes in consumption that occurred after the tax was implemented. And then I'll show you three modeling studies. The first one is a study that analyzes the changes or the expected changes in weight and diabetes once the tax was implemented in adults, and this is a study from 2017. The second one is a much recent paper in which we analyze the potential impact of the tax on children's body weight. And this was a very challenging modeling study because, as you know, children increase their weight. So you have to take that into consideration. And then finally, I'll talk about this simulated cohort in which we analyze the cost effectiveness of the tax. And this was published in 2019. And this considers both the impact in adults and in children. The next one, please. So let's talk first about this observational cohort study. The next one. So what we had was a cohort of health workers and their families in Morelos. And Morelos is a state that is very close to Mexico City. And we only included people who were 19 years of age and older. And by the time in which we started this study, we already had 2 pre-tax waves that were conducted in 2004 and 2010. And then we helped to collect data for the post-tax wave, which occurred in 2017, 2018. And we had a food frequency questionnaire with servings per day, and this was a categorical variable. And then for the analysis, we used this model, which is called ordinal logistic correlated random effects regression model, which is quite a mouthful. So we just reduced that to OCRI. And basically what you're doing with this model is that you are modeling the probability of changing between categories of SSB consumption, right? So you could have a category where no one is drinking, or you drink a little, or you drink middle, and then you drink very high. And the model is going to be analyzing the changes across those groups. Now, this is a hybrid model because it takes into account both the variability that you have within individuals over time, and also the variability that you have across individuals. So it takes into account both sources of variation, but it divides them, right? So it's a pretty nice model. And then, of course, what we wanted to see, it was beyond changes across individuals. We wanted to see if within the same individual over time, we would see changes in the probability of being in a given category of consumption. The next one, please. So what did we see? And here you can see, very roughly, very descriptively, what was the prevalence of consumption across the years. And let's start on the left where it says none. And that is the proportion of the population that reported not drinking anything, any SSBs at all. And what you can see is that in 2004, we had like around 5% of the population. Then it slightly increased over the next period of time, which is 2010. These two are pre-tax. And then you can see that by 2017, that had really increased a lot, almost double, right? And now let's go to the next one. You can see low, and we are seeing the same, right? Like a pretty steady trend for 2004, 2010, and then an increase in 2017. And now for the medium and high categories, we're seeing the opposite, right? Because that's basically suggesting that people are moving from high levels of consumption to lower levels of consumption. The next one, please. Now, once we put this into the model, this helped us to estimate by how much has consumption changed over time. And as you can see, and very similarly to what we are seeing in the descriptive analysis, we saw an increase in the proportion of people who reported none and low consumption for SSBs, and that was proportional to a decrease in medium and high levels. The next one, please. So that basically gave us more certainty over how is it that the tax is affecting consumption in the population beyond the studies that Arantxa had already done at the population level. So this was just basically this idea of showing that it is not only a matter of seeing changes in population level data, that it's aggregated and that some people could consider ecological, right? And sometimes the industry has questioned that because they said, oh, it's ecological. But once you show that the same is happening at the individual level, then you solve that. Now the issue is then how do we translate that into into changes in health behaviors, and that's a bit tricky. So I'm going to show you some examples. The next one, please. So at the beginning, one of the questions that we had is of course, I mean, with Arantxa's paper, we know how much is it that consumption has changed over time, but that's in milliliters, right? So how many milliliters or how many calories are being reduced through the tax? But how can we then translate that into a much more actionable outcome, something that people can relate to? And what we did is that we precisely used the information from Arantxa's work and also from Shuwen's work to estimate the changes in milliliters of soda. And then we use a model that translates the changes in kilocalories to changes in weight. And this is a dynamic model that takes into account age and height and weight, and the number of calories that people are consuming at baseline, and then you change the amount that it is expected to be decreased by the tax. And then at the same time, we used a different type of modeling to evaluate the potential impact of that weight reduction into the incidence of diagnosed diabetes. And for that, we use something that is closer to this type of model that it's called comparative risk assessment. And then we finally put that in relation to the population projections by CONAPA, which is the National Population Council. And we also included data for mortality so that we could have information about how is it that this would change mortality. Next, please. Now, what we did with Hall's model, and I would like to spend a little bit more time explaining this to you, is that Hall's model uses, like this energy balance equation in which you take into account how many calories are being consumed by people and how much energy is being spent through physical activity. And that balance is going to distribute in the body in different ways, right? So you can increase, for instance, your fat mass or your glycogen or your lean mass. And so basically this model, which uses these equations, helps you to translate this balance equation into fat, lean, and glycogen mass within the body. The next one, please. So this is what we found at the beginning in Mexico. This is 2012 data. We had 125 kcals per day per person. And we were expecting to have an 8.4 kcal decrease per day, and that could increase up to 15.6 kcals per day. And now, as you can see, those are very difficult to translate into a much more approachable measurements. So using this model, what we found is that we could have an important decrease in the levels of obesity. So let's just see here, for instance, where we have the proportion of people who had obesity, and that was 34% of the population. And then what we were expecting after 10 years with a 10% tax change, it's for that prevalence to decrease to 33.1%. And as you can see, that's a 2.5% with respect to baseline. That was if we were to use, like the average effect of the tax as calculated by Arantxa. But if we were to use the peak monthly, like the highest level that we observed in terms of change over that time after the tax, that would translate into 6.4% lower prevalence. And perhaps, and this is for us, one of the most important parts is, what would it happen if we were to assume that when we move from a 10% to a 20% tax, how is it that is going to change the health outcomes? And as you can see, that would increase the effects to 6.85 using the average effect, and 9.57 if we use the peak monthly. So that's, of course, a very, very important piece of information if you're considering the evaluation of two potential taxes, right? So in the end, one of the things that we did concluded with this paper is that it was very important to consider increasing the tax to a 20% level. Now, And before we leave this slide, one of the things that is very important is that very often we pay a lot of attention on the average effect. But the average effect is always tricky, right? Because there's a very large proportion of the population that is not going to be consuming SSBs, and they won't be affected by the tax. But there is also a very large chunk of the population that are consuming, and there's also, a very large group of the population that are consuming SSBs in a very frequent manner. And when we look at those, the people who were in the highest quartile of consumption of SSBs, then the decrease would be 7.3% and 18.3%. So it is very important that when you're modeling this, not only to pay attention to the average, but to pay attention to the groups that are going to be benefiting the most from the tax. The next one, please. Now, then a couple of years ago, we started to talk about the importance of modeling the impacts of the tax for children. And this is key, because children are going to have longer benefits if we manage to prevent obesity or reduce body weight early on in their lifetime. So it is not only a matter of body weight, but it's also about the possibility of them reducing the incidence of cardiometabolic diseases later in life. And of course, then we started to think about how to do this. And fortunately for us, Kevin Hall had already put out a model for children and adolescents. It was very challenging because you need to revise the model and to make it fit to your population. So it is not only a matter of running a model, you have to calibrate the model, and that took us quite a while. But after we did that, we were able to project the potential impact of the tax on children's weight. And here you can see that we have moved from only considering a 10 and 20% scenario to go a little bit further and to consider a 30 and a 40%. And we think that this is absolutely necessary. I think that at the beginning we were very conservative in the way in which we wanted to model, and we restricted ourselves to the 10 and 20% scenarios. And that is not necessarily a good idea. I think that we need to show the real potential of the tax if governments are willing to move ahead and to consider a stronger scenario. And as you can see here, for instance, here we have changes in kilograms. And you can see that if we were to move to a 40% tax, then we will expect a 1 kilogram change in children who are 6 to 11 years old, which is a lot in terms of weight reduction. And for adolescents, that could be up to 2.4 kilograms. So in the end, with this model, what we can show is that sometimes, the industry has said, well, the expected effects of the tax are going to be very small. Yeah, of course, because in Mexico, we only implemented a 10% tax, is a very, very low tax. But if we were to move it up to 40%, then we will start seeing some pretty sizable changes. The next one, please. We did a sensitivity analysis here because there's always this question of how much uncertainty there's around our estimates, and we can create as many scenarios as you want. So one of the things that we're doing now is that we are providing the readers with a full picture of all the potential impacts considering different scenarios. So what you're seeing here, for instance, is how many calories would be compensated in the y-axis. So if we were to compensate 100% of the calories, for instance, and what is the level of the tax? So it is from a 10% up to 100%. And this basically gives you a full idea of the potential changes in impact as the assumptions change. So we think this is a very transparent way of showing where is it that your results are. And as you can see, we consider a pretty large set of assumptions. And so we feel very comfortable with the results. The next one, please. And then finally, we'll talk about cost effectiveness evaluation, the next one. And for this, we partner with some colleagues at Harvard who had the choices model, which is a simulated cohort where you basically build up a population that resembles a Mexican population, and you're following them over time. And what you do basically is that you create a baseline scenario where you're not doing anything and you're just letting the population change as they are doing right now under the current situation. For instance, under the current obesity rates and under current incidence of diabetes and cancer. and then you see, you know, after some time, where do they end up, and what is the final incidence and the number of years that people, of healthy living years that people have lost. And then after we have that scenario, then we create an alternate scenario, right? And in that scenario, we included the effects of the SSB tax in terms of changes in SSB consumption, which were then translated into changes in BMI distribution. And then after that, we linked that change in BMI to a reduction in risk for 8 obesity-related diseases, which included, of course, cardiometabolic, but also some cancers. And with that information, then we can then compare the baseline scenario to this new scenario and calculate the difference in mortality, QALYs, and healthcare costs. And with that, we estimate the cost effectiveness. The next one, please. So this is how much we expected for consumption in kcals per person per day to change over 2 years, 2 years after the implementation of the tax for men, women, and by age group, right? So children and adults. And then we had different levels according to the potential scenarios for the tax. And you will see here we have 1 peso per liter, which will correspond to the 10% tax, 2 peso per liter, and 6 peso per liter. And as you can see, the difference is quite striking, right? So if we were to move, for instance, to a 6 peso per liter, that will produce a 62 kcal per person per day reduction, which is a lot in terms of population impact. Then next one, please. So once we did all of the modeling, then we could estimate the potential impact that the intervention would have in obesity, prevalence reduction, and cases prevented. And then, as you will see in the table below, the number of cases that we were to be able to prevent through this intervention. And we included breast cancer, endometrial cancer, colorectal cancer, kidney cancer, stroke, hypertensive heart disease, ischemic heart disease, and diabetes. And as you will see here, the most important in terms of weight is diabetes, right? And Mexico has one of the highest prevalences of diabetes in Latin America. So I'm gonna move to the next one, please. And here, what we have is a comparison of the impact in terms of effectiveness for the 1 peso per liter and the 2 peso per liter scenarios. And as you can see, we will be able to gain close to 1,000 life years with the 1 peso per liter and 1,600 with the 2 peso per liter. For DALIs, we'll have 5,800 with 1 peso, and then 10,200 for the 2 pesos. And so we basically had all of these information. And then we also had information in terms of healthcare costs saved. And those are in US million and includes both the total obesity related costs saved. And then we also have the net healthcare costs saved. And as you can see, those are pretty sizable reductions in costs. And then at the same time, with the help of Arantxa and her team, we estimated the implementation costs, and basically that includes the design of the tax and the implementation of the tax from the governmental standpoint in terms of how much is it that the government is spending to do that and to manage, let's say, the tax. And that was 24 million compared to the 92 and 160. So once you take that into account, we end up in the conclusion that you will save close to $4 in healthcare costs per every $1 that we invested in the tax, in the 10% tax scenario, and that will be $7, basically rounding up, $7 saved per every dollar that we invested in the tax. And we concluded that for all, in terms of life years, DALIs, QALYs, it was cost saving. The next one, please. So there are some challenges, of course, to modeling these interventions and the impact that they have in the population. One of the things that I can say is that I think these studies have been extremely useful to help people understand the real impact behind the tax. Because if you keep it at milliliters and kcals, that's just very, very hard. There's a study that I did not put here, but it might be interesting for you. And that's a study in which we estimated the burden of mortality associated to SSBs. And I think that that type of study is also very useful for people to actually see the full impact that SSB's consumption are having in our population. The next one, please. So beyond this issue of modeling studies helping translate to health outcomes, one of the limitations that we do see and we are trying to solve is that at least for the first studies, those that are focusing in weight change, we had to rely on a steady state assumption just to make the model a little bit simpler. So that basically means that we are modeling, keeping the same conditions that we had at baseline stable over time. So there's no change. And that is not necessarily the best way to do it, right? Because we know that, for instance, in Mexico, the obesity trend for some groups is still increasing. So it will be better if we could include that into the modeling. So right now we're working with different approaches to do that. And we hope to have a better model soon. And then I think that the second challenge is to try to move to the assessment of observational data or real conditions, right? So just like Arantxa's oral health paper, in which you can analyze how is it that some of these health outcomes have changed. This is very hard because, as you know, obesity, diabetes, hypertension, all of these diseases are chronic diseases, and it is hard to predict exactly when are they going to change. And it is also hard to observe those under a context in which obesity is still increasing. So, and then finally, there are also some methodological limitations or difficulties that may be complicated to solve, right? Such as a very large sample size that you would require to see, for instance, a small change in obesity. And that requires also very precise measures, which are very difficult to do in that level of study. So thank you. And if you want to put the next one. And I will now give the floor to Karen. Thanks.
Hi. Thanks very much. And I appreciate being invited to this talk. It builds somewhat on the work that well, the presentation that Shuan gave earlier, although there probably are things that I should have included here. But anyway, let me talk you through what's gone on here in South Africa, which is, I think, very interesting. And we have some information. Beginning of the data is starting to come out now, following 1 year of the taxes. Okay, next slide. So I think it's important to understand what the context is. Obviously, the context has changed for all of us, but I just want to talk very briefly about the changes in South Africa since the HPL, the Health Promotion Levy, which is the sugary beverage tax, was introduced in 2018, and the COVID pandemic. So there's been a significant increase in hunger, and a lot of increase in consumption of cheap ultra-processed food. And the majority of COVID deaths are obesity related. Next slide. So this slide shows you the comorbid conditions for COVID hospitalizations by age. And you can see that these blue circles take up the majority of the circle, especially starting in the 40 to 59-year-old age group and going into over the 80s. So everything, those 4 circles at the bottom are in blue, are NCDs, and those are the hospitalizations from COVID that have people who have NCDs. This is particularly bad in South Africa. And we also have our usual pandemic related to HIV and TB. The HIV is red and the TB is green, but you can see by far the cost to South Africa in COVID has been from NCDs. Next slide. And we also have, as a result of COVID, a huge increase in unemployment. This is the official unemployment rate, 32%. That's the national official unemployment rate. The fact is that it's probably closer to 45% if you take people who are discouraged and stopped looking for jobs. And in some provinces, this is as high as 70%. So it's not something that we can easily just dismiss. And I can tell you that it's a big issue for us. Okay, next slide. Just trying to see what I'm being asked to do. I've just turned on my camera, yes. So after 1 year after the 2018 legislation, the summary of the case is it's working in South Africa. And because of the design, and I'll go into that in a little while, the individual beverage intake shows overall sugar reductions from two sides. The one is the industry has reformulated. There's a reduction in sugar content and in container size, and the consumer has decreased the volume, their volumes of intake. So just to build on what Shuan indicated at the beginning, when we started this work, we did some modeling on an ad valorem tax of 20%. In the end, the tax was a specific tax, the kind that Shuan talked about. And I'll show you some of that in a minute. So I just want to say that what we did at the beginning, which was doing some of these modelings on diabetes and hypertension and some of the other issues that have been discussed, it wasn't on the same design as we ended up with. Next, please. So the way we've done this is we looked at consumer responses to sugary beverage taxes, changes in household beverage purchases, looking at smaller samples in particular areas. We also looked at industry responses, and then we did some related work on equity issues and political economy and policy analyses. This work took, well, the first part of it to get this passed was by 2016, there was an announcement made, and then in 2018, the tax was passed. But in that interim 2 years, the tax design was changed. Next slide. So this is a work that was led by my colleague, Nick Stacey, and it shows you what happened as a result of the tax, which is, as was indicated, 21 cents on the rand over 4 grams of sugar. So the first 4 grams of sugar, the first teaspoon of sugar in any product was not taxed. After that, it was taxed at 21 cents on the rand. So that is not an ad valorem tax, it's a specific tax with all the things that go with that in terms of the design. And this is what happened to the beverage prices. So if you look at the first upper left-hand corner, the carbonates increased in price. And I'm going to come and give you some details about those carbonates. The next one on the right was bottled water, which went up a little bit, but basically remained the same, wasn't statistically significant. The non-carbonates in the lower left-hand corner did not change, and the 100% juice, which was actually excluded from the tax, did not change in price. So when this was introduced, it was just a tax, a specific tax on sugary beverages. Okay, next slide. And so that these sugar-based taxes present multiple margins through which the industry could respond to this HPL. And this is actually what happened. So with respect just to the carbonates, they passed on the increased price as a tax to the consumer on the sugar-based products. And these revenues accrued to the Treasury. So that was the revenue from the tax. But at the same time, they also the industry also pursued higher margins for their own profit on untaxed products, including diet drinks. So the cost, for example, of a Diet Coke went up as well, or a Coke Zero also went up. And that was how it worked in South Africa. Next slide. We also had large reductions, this is also results, in taxed beverages, tax beverage intake in subnational jurisdictions. 1 year post the health promotion levy, there was a survey of young adults done in Langa in the Cape with self-reported intakes of taxable beverages that showed a 37% reduction by volume and a 31% reduction from sugar intake. And then also in a smaller subnational jurisdiction in near Johannesburg, in part of Johannesburg, there was a cohort study of 750 adolescents, young adults and older adults in Soweto, Johannesburg, where the frequency of sugary beverages intake fell amongst the heaviest consumers from 10 beverages per week before the HPL to 4 beverages per week afterwards. Next. And of course, there was a tax revenue after the implementation. In year 1, there was a 3.2 billion rand revenue, which is equivalent to $213 million US, which is a very small amount of the total government revenue. And it's certainly quite a lot less than we get from our taxes on alcohol and tobacco. And in the first, but it's significant, it's not zero. And in the first 2 years, there was a smaller amount of revenue, but the total for the first 2 years was 5.8 billion, which is about $387 million US. I just want to say that the annual cost of diabetes and hypertension in South Africa is huge. It's 13.2 billion. So it's about 4 times the amount of revenue that is brought in, but this is only at the equivalent of a 10% tax. So when this tax was changed from the original design of 20%, the industry came in and bargained with the government. They got the government to change the tax from a 20% ad valorem to a 10% specific tax. And it hasn't really gone up very much with inflation, I might add. But the cost of diabetes and hypertension in South Africa is just huge. We have similar kinds of numbers to, I think, what Arantxa described, which is 14% of the population have diabetes and at least 30% have hypertension. So, and many of these patients, especially the diabetics, are not diagnosed. So the reason for the such a high annual costs, especially with diabetes, is that many of these patients develop very severe complications towards the end of their life, which then costs a huge amount of money to manage them, because many of them require at least 5 amputations before they die. So in addition to the blindness and the renal failure and everything else, as well as the hypertension resulting in strokes and other things. Next, and we haven't included cancer here. So in South Africa, we have, if not the highest inequality index in the world, a Gini coefficient of around 0.65. For those of you, it's just, it's really unequal, however unequal it is anywhere, probably except for Brazil. It's really shocking. And what's important here is, as with Mexico, the lower socioeconomic urban households reduced their volume from sugary beverages by 32% and sugar from sugary beverages by 57%. And the lower socioeconomic households are responding more generally in absolute terms in their reductions, which address the health promotion goals of the HPL. Of course, as across the globe, there's been a lot of discussion about regressive taxes, and of course they fail to look at the fact that this is progressive for health, and this is something that industry does across the globe. Next. So I want to just talk a little bit about the industry responses, because this tax certainly forced industry, I think, to make some changes. Next slide. Just want to show you, this wasn't significant, but we did actually do, we looked at the advertising patterns before and after the taxes were introduced. And I can tell you that there was an increase in advertising just before the tax was introduced on the left, in carbonated beverages and on bottled waters. It also went up quite significantly. So they were positioning themselves. Next slide. And I don't have to tell the people on this call about this, but there were the industry tactics continue in South Africa. They commission research, challenge or cherry pick the evidence. They challenge the peer-reviewed research, despite the fact that it's South Africa specific. They use delaying tactics and sow doubt. They use inflated job loss projections in the media, and they present their own arguments without support. And we've documented all of that. Next. So this is the summary here. The industry was responsive to the tax in terms of reformulation. The industry passed the tax on to the consumer. The heavy consumers and the lower socioeconomic groups decreased their intake of sugary carbonated drinks. The health promotion levy did raise significant revenue with no official ring fencing, and there probably will never be ring fencing in South Africa. They've never done it, and they're pretty adamant that they won't ever do it. And the non-communicable diseases certainly continue to grow in South Africa, with COVID emphasizing the importance of preventive policies. Next. So thank you very much to our funders and to our research team and our collaborators. Thanks very much. Last slide. Thank you very much. Thank you.
Thank you very much, Karen, and to Tona and Arantxa and Shuin for those great presentations. We have a lot of questions and comments coming in. So I'm going to actually ask if our panelists can turn on their videos and their mics. So we have a number of questions. I'm going to try and get through as many as I can. And I want to start with something that I think each of you touched on, which is this earmarking and ring fencing. And as Karen pointed out, in South Africa, I know amongst our partners, this question has come up, but it hasn't ever been done, as Karen has mentioned, but also given the impact of SSBs on health, we have the example from Philadelphia of ring fencing, earmarking the money for the revenue. I'm curious, what kind of data do you think that we need to make this case? How do we make the case and what's the resistance to using some of the revenue for marking it for health programs?
So if you want, I can answer what the problem is in Mexico is that in general, the government and the Ministry of Finance, what they say is that they need to have some flexibility on how to allocate the resources they have into priorities. And so this is the argument they've been this is what they argue, and it's been difficult. So we only say that for very specific taxes, Piguvian taxes, we should earmark maybe not 100% of revenues, but part of it. So I think the new administration is more open to that, but they don't want to increase taxes. So it's a difficult combination in Mexico.
Karen, I know
I'm happy to add to that. I think it's pretty similar. Their big argument, I don't think any evidence will change their mind. In summary, They feel like they can't rely and know how much they're going to get each year. And if they think the tax is actually working, then fewer people will actually buy products. So that's their main rationale. But they also have said, I've spoken to many Treasury officials, and they are absolutely adamant. We have never done this, and we will never do this. I think that many countries, including South Africa, are now going through a very terrible time as a result of the pandemic, and they need to make those funds as fungible as possible. So I'm afraid that we can do as much research as we like, it won't help.
I'd like to pipe in quickly as well on this. I think for national level taxes, it is virtually impossible to earmark or ring fence revenues from these types of taxes. Although there are some examples, like in Thailand, where they have created public health foundation and directed the revenues from health taxes like tobacco, alcohol,
Right.
and SSBs into that foundation. And then, there's a process for determining the use of those funds for campaigns and other efforts. So there are alternative mechanisms in which to explore and for countries to consider. I also want to sort of speak because I think there are some people in the audience that come more from a U.S. standpoint, and in the U.S. with the local taxes that have occurred, the way in which the ordinance, most of the cases actually, the ordinances have been written have included the development or the initiation of commissions or a board to determine the use of the revenue that varies, from cycle to cycle, year to year, and therefore builds in and tries to build in sort of uses of the revenue for needs that the community has. So for example, in San Francisco and Seattle, they actually used some of the revenue from their local SSB taxes towards providing fruit and vegetable vouchers for low-income households. So there are, and that was in response to COVID in particular. So that was like one way in which they were able to incorporate the needs of their community into, and link it to the SSB tax, which is a very, you can argue is rather more equitable, and it accounts for sort of the voice and agency of people in the community as well.
Thanks all. And we've had a number of questions too about impacts on employment. This is obviously, as Karen mentioned and Arantxa mentioned, this is a big industry argument against the tax, particularly in countries that have a strong sugar industry. And so there have been a number of questions about the kind of data that we need. Arantxa, you presented on some of that, and Karen, I know Priceless has done some more informal studies around that, and I'd love to hear some of your thoughts on what is, again, going back to the evidence, what is the evidence we need to make this case? I mean, how do we keep countering this? Again, in South Africa, the industry continually has this mantra about being impacted, yet there isn't data coming out of them that backs that claim up.
Well, there is no evidence actually in South Africa. They've published some information, the beverage industry, and there isn't actually a loss of jobs. And many of the loss of jobs, the things certainly from the beverage industry side, were planned and people were put onto long-term contracts. There are lots of things going on in the sugar industry. There's a lot of misinformation. It's very hard to counter it specifically. These job losses are sort of hidden by the industry and we can't get hold of them. But there is actually no evidence from them that, I mean, there might be a few job losses. I can't say that there wouldn't be several hundred, possibly. But they disproportionately blame the sugar tax, whereas in actual fact, what's really going on are very serious issues within the sugar industry and the beverage industry as to how they manage their workforces. So for other reasons, there's a lot of the sugar lands in South Africa have been sold off and very badly managed in that way. And they try and deflect from that. So it's very difficult to sort out exactly which is which. Yeah.
Yeah, very, very quickly, but we are lucky in Mexico that we have a lot of data. And so we have data that the industry surveys that the industry has to report on their sales employment from the manufacturing industry and the commercial stores. So we were lucky to be able to use them. So if countries have them, they should use use the data. Otherwise, although it's very complex, there are models that have in the US. Lisa Powell has done some work on modeling the potential effects of the tax on employment, and that's also a good way of doing it. But we need, and the thing is, because the industry produces some of the substitutes, it is unlikely that they're going to have problem employment reductions, and even the commercial stores saw these substitutes.
The question I kind of wanted to ask you is about, I know our partners in Brazil have talked a lot about ultra processed products, and there has been discussion, I think, in a number of the countries that we're working in around broadening the SSB tax to actually include ultra processed products, right? I mean, sugar is not the only issue. So I'd actually love to hear from the panel your thoughts around broadening the tax to include ultra processed products.
I think Arantxa can start because Mexico also implemented a non-essential food tax. Arantxa?
Yes, thank you. And so yes, in 2014, we also have these taxes to what we call non-essential energy dense food. And so it's mostly, these are ultra processed foods. It's an ad valorem tax of 8%. It has been evaluated, and it has shown reductions in purchases. And I think it's a good, it's an interesting tax. So foods on this tax are very diverse, very heterogeneous. So it's difficult to have an excise tax for all of them. So this is why Mexico decided to have an ad valorem tax, but I think that should be included, although there's a lot of literature on the adverse effects of SSB on health and less on ultra-processed food, but it's coming. So I think it's a good idea to include them if it represents a good share of the diet in the countries.
I would like to add to that too, but Karen, if you want to go, please go ahead.
I mean, there's been quite a lot of discussion around these kinds of taxes in South Africa. It's certainly been raised. I think the Treasury is actually saying we will raise the taxes if we can see that there are other, on the sugary beverages at least. I think they would be open to processed foods, ultra processed foods, and it really needs to happen urgently. But I think that they want to see other policies be introduced as well, so that they can say, all right, look, we've now got labeling, we've got marketing bans, et cetera, and then we can also increase the sugary beverage tax. So that's my sense from, I think it's not so much about the evidence per se, it's about other policies and being part of. They don't want to be seen as the only group that's doing things. They want to be able to do it. They definitely want to be able to increase the tax, but they also want to see other things happening. So it's a different context slightly.
Yeah, I mean, building on this, I think there's also the issue of how do you implement something like an ultra processed food tax? And so thinking about like building off other policies like labeling, for example, and actually now Mexico has one as well. But, you know, that's going to happen in Brazil. and already exists in Chile and Peru, for example. You know, how do you build of those, the existing policies like labeling to design the ultra processed food tax as well, is one consideration, right? Like it's difficult to sort of operationalize what products are going to be taxed. And so having an existing mechanism that allows you to do that well and efficiently and doesn't add a lot more burden onto the agencies that have to actually implement it is important. So I think this is also where some of these other policies and integrating these various policies together is important. It also sends a very consistent message to manufacturers, because the same things that are going to have labels, possibly warning labels, or being regulated for marketing are also going to be taxed, right? So that if there's consistency there to the industry, they're more likely to change the portfolio of their products. And to the public, right? Because they're also getting the same consistent message as to what types of products they're seeing getting advertised or not. And then also the price differentials. So I think, you know, on all sides, thinking about integrating these policies will be really critical.
I just realized I was on mute. Apologies. There are lots of questions coming in. I think we'll try and collect those questions so that they don't get lost. But I'm seeing we have 2 minutes left, so I want to be mindful of time. And just thank Karen and Shuan and Arantxa and Tona for taking the time. We really appreciated hearing your perspectives. And I want to thank everyone who joined us. We're going to learn more about SSB taxes. Their PAHO is going to be hosting a virtual launch of the report that Shuan mentioned in her presentation on sugar sweetened beverage taxation in the region of the Americas on Friday, April 9th. And then please join us as well for part 2 of our SSB tax advocacy webinar, where we're going to have legal and communications experts from the Caribbean, Brazil, and Mexico discuss how to prepare legal challenges and how to fight opposition through effective narratives. So that part 2 will take place on April 14th at 10 a.m. Eastern Daylight Savings Time. And we will be sending the slides and links to some of the reports and some of the resources that were shared through the chat. And as well as information how to register for both of those webinars. I want to thank all of you participants and our panelists for kicking off our 2021 webinar series. Hope everyone has a good day and good evening.
Thank you so much.
Thank you. Thanks. Thank you. Bye.
Bye.
Bye.